Summit is an ongoing clinical trial of Bezuclastinib, which is a novel, highly potent and selective inhibitor of KIT D816V from Cogent Biosciences in patients with indolent and smoldering systemic mastocytosis. Bezuclastinib is an interesting drug in that it is highly potent and selective for mutant KIT, like avapritinib, which was approved last year for advanced SM and probably will be for indolent SM based on the positive top-line results of the Pioneer trial. But in the case of Bezuclastinib, it has a couple of distinctions which could be advantageous. So, for example, it has minimal penetration of the blood-brain barrier, and that could lead to reduced adverse events in the central nervous system, such as cognitive adverse events, intracranial bleeds, things like that. These have been seen with avapritinib, for example, and the intracranial bleeds with avapritinib have occurred in patients with very low platelets, which you typically see in advanced SM, but nevertheless, something nice to be able to avoid. And then also, Bezuclastinib is extremely selective. Avapritinib itself is very selective for mutant KIT, but Bezuclastinib is even more selective. So with sparing of other kinases which might be related to off-target adverse events. For example, PDGFR. That is a kinase that is inhibited by avapritinib and could play a role in bleeding events, for example. So Bezuclastinib has the promise at this point of being more selective for its target than avapritinib, and also avoiding the central nervous system issues by having minimal penetration of the blood-brain barrier. So Summit is designed similar to Pioneer, which was the pivotal trial of avapritinib in indolent systemic mastocytosis, based on which Blueprint is filing for approval for avapritinib in that indication. Summit is similarly designed, and there are several doses being investigated against placebo. There is a part 1 where you try and identify the dose to go forward with, and then there is a part 2 that is against placebo, a large randomized part 2 with symptoms as the primary endpoint, which is what you would typically do in a study in non-advanced systemic mastocytosis, since survival happily is very good. So symptoms really tends to be what we try to make a difference in. So again, symptoms, primary endpoint, placebo-controlled in the part 2, randomized, double-blind. In the part 1, dose identification, that's the phase they're now in. And like I said, the drug has some theoretical advantages over avapritinib.